When I design a hairline for someone in their 20s, I'm looking for that hairline to be something that they could age with, not necessarily having a hairline that may look good when you're 20, but more one that will look good when you're 40. And that's how you approach it.
Best time to have a transplant is ultimately when it bothers the patient enough to undergo a procedure, but there are certain age considerations.
For me personally, what I like to do is, like, especially my younger patients, is really make sure that they understand the progressive nature of hair loss, especially someone who presents to me in their 20s. And then ideally, I get patients, the younger patients, on medical therapy to help stabilize the loss, and really pretty much take it from there.
Yeah, I think another advantage about requiring patients, particularly those like 26 and younger, to be on med therapy, it shows a commitment. Because if they can't do it prior to a transplant as a condition for having the procedure, then more than likely they're not going to use it post-operatively, and then potentially they'll be problematic. They'll
Exactly.
have cosmetic issues.
And the way I like to explain it, as far as like hair loss, it's like almost like high blood pressure or tooth decay, right? It's always going to happen. It's going to be progressive. You have to do something to significantly slow it down or stop it. So, especially with younger patients who are most likely actively shedding or have a potentially, given their young age, they will develop advanced hair loss. If you don't start medical therapy and have a hair transplant, then that effect in a year or two, may be the same or less than having combined medical therapy with hair transplantation.